Hello, class, and welcome to this week in diverse populations. This week, we're going to be diving into working with Native American populations. Now, this might seem redundant since we're focused already on the Sisseton-Wabiton College and the Lake Traverse Reservation, but I hope that just makes this not a detached academic subject. These are our families, our communities, our colleagues, and our ancestors. Now, and for others, it may be the first time you've engaged deeply with experiences and history and healing knowledge of Native peoples, and that's okay. But I want each of you to kind of reflect upon the idea that we need to approach this with respect and humility and a willingness to recognize that Western counseling models have often failed Native people. Not because they are ineffective in theory, but because they are applied without cultural context or historical understanding or relational accountability. So, as we explore the realities Native clients carry into the counseling room, including historical trauma, spiritual disconnection, systemic racism, and the legacy of colonial policies such as boarding schools and land theft and religious oppression, be mindful that there are some very clear strengths and resilience and knowledge systems that have endured and continue to guide Indigenous healing today. So you'll hear terms like sovereignty and cultural continuity and ceremonial healing and community-based intervention. These aren't just buzzwords. They are living practices rooted in thousands of years of Indigenous wisdom and adapted through generations of survival and resistance. So, today, when we kind of explore this topic, I want you to kind of reflect upon what does it really mean to offer culturally safe care to Native clients? How do we move beyond inclusion and toward respectful collaboration with Native nations and traditional knowledge keepers? Now, as always, I like to tell a little story. And our little story today will also tie into our first theme. And our first theme for today will be historical trauma. And here we'll look at how it shows up clinically today in high rates of substance use and suicide and PTSD and mistrust of institutions and internalized oppression. And we'll explore the idea that trauma is both private and collective. It's something that we experience individually, but also as a community. It's a collective and cultural wound that requires community-rooted healing as well. The second theme for today's lecture will be exploring Indigenous models of healing and recovery, looking at how do Indigenous communities define healing. And so we'll explore some concepts like the medicine wheel, the red road of recovery, ceremonial healing, and the role of elders and kinship and language in restoring balance. And then finally, we'll look at what are some ethical and relational responsibilities in clinical practice. We need to kind of always remember what it means to be a counselor in a space where colonial harm has come through helping professions themselves. So we'll talk a little bit about the importance of cultural healing and sovereignty and avoiding appropriation, and how to build ethical relationships. So we'll explore things like decentering ourselves as the expert, and how to make space for community to find healing goals, and how to advocate within your agencies to support culturally rooted services. Now, the story for today. In order to really kind of understand what it means to work ethically and insightfully with Native clients, we should really begin by honoring some of the voices of those who have shaped that conversation from within the Indigenous experience. And one of the most influential among these is Dr. Maria Yellow Horse Braveheart. She is a Lakota clinical social worker, a scholar, and mental health leader who has helped to develop the whole concept of historical trauma, both in academic as well as clinical awareness. And she still serves at the University of New Mexico. Now, Dr. Braveheart's work began with a simple but profound observation that the emotional and psychological suffering she witnessed in Native communities was not only personal and not always rooted in direct individual trauma, but rather it was inherited in a deeply intergenerational experience, passed down like memory, like silence, like ceremony interrupted. And so she coined the term historical trauma to describe this very unique collective experience that accumulated grief and loss caused by colonization and boarding schools and cultural genocide and land dispossession and systemic violence has led to a trauma that is not just something that happened in the past, it is a living wound carried in people's bodies and in their families and in their family structures and in the community structures themselves. And so she has worked to develop the historical trauma and unresolved grief intervention approach, which is really a culturally grounded group model that incorporates education, collective mourning, and traditional practice to address grief and loss and addiction in Native communities. And a research often conducted with, rather than simply on, communities has had lasting influence. It's helped clinicians and counselors understand that trauma in Indigenous communities is not always expressed in flashbacks or nightmares, but sometimes as silence, as substance use, as rage, as disconnection from identity, or longing for something unnamed. So, it's understanding that people have grief that is not recognized, and it's important to name that before a person can heal. That grief isn't just clinical. It is cultural, it is spiritual, it's about children taken from parents, it's about languages removed from their mouths, it's from ceremonies outlawed, and the ongoing invisibility of natives' lives in dominant health cultures and systems. So, it's about helping communities to find resilience and identity and community. And so I hope you see in there how Dr. Braveheart's work calls all of us to see both the pain and the power, the wound and the medicine within Indigenous communities. Now, let's look a little bit more at how we can work effectively and ethically with Native American clients. And part of that being to understand a form of trauma that is both ancient and ongoing. So, as Dr. Braveheart introduced her concept in the 1990s, she was naming something that Native people had long carried, but had rarely seen validation in clinical spaces. The idea that grief and suffering carries from one generation to the next through colonization, through broken treaties, through forced removals. And these carry echoes across time. And so the entire community can be shaped by unresolved grief. And that way of being can be caught by those growing up within it. It's trauma that is transmitted through genes, through stress, through broken patterns of coping, through disrupted parenting, and through chronic stress responses. So as a counselor, it is essential to recognize that when a Native client comes in, say for example with depression or anxiety or addiction or suicidal ideation, we're often seeing symptoms of a much deeper hurt. Yes, they may have experienced personal trauma, but they also, and this is something that needs to be explored, did they inherit grief that is from previous generations? Has it been passed down through generations, unspoken, but deeply felt? Is it a collective trauma? Is it a cumulative trauma? It's something that is often invisible in traditional Western clinical frameworks. We tend to just think in terms of the person and their immediate experience, maybe their experience with their parents, not what did their parents inherit and what did their grandparents inherit and their great-grandparents inherit as far as mistrust of systems of care, as far as needing to survive in a system that tends to oppress them. So historical trauma isn't just about pain, though, because the client is there. So it's also about survival. The fact that Native people still exist, still speak their language, still hold ceremonies, still raise children and lead movements of justice, is a testimony to resilience. And so we need to recognize that historical trauma in our clients is something that should be labeled, but it doesn't label them as broken. It labels them as survivors, as someone that is resilient and strong, and help to transform that inherited pain into a living strength. Now, if historical trauma helps us understand the wound, then indigenous healing systems show us the path toward wellness. And these aren't abstract metaphors or borrowed self-help techniques. These are structured, place-based, spiritually grounded systems of knowledge and transformation that are passed down for generations, even in the face of attempted erasure. So, two of the most widely known and practiced frameworks of in Native communities today are the medicine wheel and the Red Road of Recovery. And while these models vary in interpretation from nation to nation, their shared teachings offer a really powerful alternative to Western views of health and addiction. And one is rooted not in pathology, but in balance and relationship and spiritual accountability. So let's begin with the medicine wheel. The medicine wheel is a sacred circle used by many of the Plains indigenous cultures, including Dakota and Lakota communities. And it really represents the interconnectedness of all things, the four directions, the seasons, the elements, the stages of life, and the four dimensions of being, the physical, the mental, the emotional, the spiritual. And in this model, Wellness is not defined by symptom relief or behavioral compliance. It's defined by balance. When one part of the self is out of alignment, the emotional, the whole person really suffers. So, for example, if someone is spiritually disconnected from the land or ceremony or from their ancestors, that disconnection can manifest as emotional depression or physical illness or destructive behavior. And this perspective is radically different from how Western addiction treatment often operates. In Western systems, the focus is often on changing behavior, managing cravings, avoiding relapse, learning cognitive strategies. But in many indigenous frameworks, addiction is seen less as a disorder and more as a response to spiritual loss, a symptom of deeper disconnection, not just from self, but from culture and land and sacred purpose. And so this brings us then to the Red Road of Recovery, which is really a spiritual and cultural path that many Native people follow as part of their healing journey. So walking the Red Road is not about abstinence. It's about living in a good way, with humility, with honesty, with courage, and with respect. It's about reconnecting with ceremony, with elders, with language, and with the Creator. It is, at its core, a relational and spiritual commitment to walk with integrity, not just for the self, but for the community, for future generations, and for the earth. And many Indigenous-led recovery programs are built around these frameworks. And rather than isolating the individual, they surround them with community. Rather than focusing on deficits, they emphasize strengths. Rather than dismissing spirituality as unscientific, they center it as essential. Healing becomes a service to receive by a way of being to return to. And for clients who have lost that connection through removal and assimilation and incarceration or internalized shame, the process of recovery often begins with remembrance, remembering who they are, where they come from, and what it means to be in right relationship. As counselors, then, our role is not to teach the medicine wheel or walk the red road ourselves, unless these are our own teachings to carry. Our role, rather, is to respect these paths, to make space for them, to collaborate with elders and cultural mentors when invited, and to recognize that healing may not look like what we're taught in Western classrooms. So healing in these frameworks is not about fixing what's broken. It's about returning to balance, remembering sacred teachings, and reclaiming what has been lost. Now, what does this mean when we are looking to serve Native clients in a way that is not only effective, but also relational and culturally accountable? Well, first, we need to begin by decentering ourselves. In other words, kind of take a client-centered or person-led approach where we're not considering ourselves the experts. We are a companion walking with the person. In a lot of Western counseling models, the clinician is positioned as the one who knows the knowledge and gives the diagnosis and interprets the client's behavior. But in this approach, it's about recognizing that the client comes with memories and community and connections already, and they want to get better. So it's not about overruling people or misdiagnosing people or misunderstanding people and erasing all of this. It's about working in a place where we shift from cultural competence to cultural humility, where we recognize that there is relational accountability in the community of healing, that in Indigenous worldviews, relationships are sacred. And they come with obligations, not only to the person you're sitting with, but to their community, their ancestors, their descendants, and the land they come from. When you counsel a Native client, you are not simply helping a person in isolation. You are entering into a web of relationships that has meaning and memory. So relational accountability means asking questions as a counselor like, who am I in this space? What are my responsibilities to this person's culture and community? Who needs to be involved in this healing process, and am I making space for them? So it's not about us being the one that cures the client. It's about us helping the client find the places where they can find healing. To recognize that culture can be a place for that. And for us that are not natives, to avoid cultural appropriation. It's not appropriate for non-native counselors to lead sweat lodge ceremonies, to teach the medicine wheel, or use sacred objects or symbols without permission and without deep understanding. That starts to violate ethical boundaries. It disrespects the sovereignty of native nations and sacred knowledge systems. If you're not Indigenous, your role is not to replicate or interpret traditional teachings. Your role is to support the client's access to those teachings in respectful and culturally appropriate ways. Now, that might include making time in the treatment plan for a ceremony, or advocating for the client to access cultural services. And that is entirely appropriate. Ethical practice means advocating within your workplace or system to ensure that Native clients are not expected to leave their culture at the door. It may involve speaking up when forms or procedures or expectations do not reflect cultural realities. Again, that brings us back to, who am I in this space? And our role is to create a space where Indigenous clients feel safe, feel seen, and feel culturally affirmed. Now, it's important to name some of the core principles here, I think, that are part of working with Native peoples. The first one for counselors is cultural humility. And this is more than just having some knowledge of Native history or traditions. It's about the ongoing, lifelong commitment to recognize what you don't know, to question your assumptions, and to approach each client as a holder of wisdom, not just pain. Humility reminds us that even the best intentioned counselor can cause harm if they walk into session thinking that they're the expert on all things. With Native clients, humility means slowing down, asking permission, and being willing to take direction, sometimes from the client, sometimes from an elder, sometimes from the culture itself. Next, it's about historical awareness. You can't provide culturally safe care to Native clients if you do not understand the historical forces that shaped their lives and their families and their communities. And this includes colonization, boarding schools, religious oppression, land dispossession, forced sterilization, child removers, broken treaties. All of this also includes survival and resurgence and resistance. Native peoples are not only defined by trauma, they're defined by endurance, by creativity and sacred continuity. And a counselor who understands this does not pathologize silence and mistrust or spiritual expression. They recognize these are survival strategies and sometimes as acts of sacred remembrance. And finally, the whole idea of relational accountability. Because within Indigenous worldviews, healing is not about the individual alone. It is about the community. It is about the land. It is about spirit and family and community. It is about living together. So these principles of humility and historical awareness and relational accountability are the foundation for counseling Native clients. And this helps us not only be competent, but honor them. And that's important because they are people of value. And we always need to recognize that. Now, let's take a little bit of time and just explore a little bit of the red road of recovery, which is a path that is not simply about stopping substance use, but also going beyond that to wellness, to restoring balance, to restoring identity and relationships with all of creation. And in many Indigenous communities, including Dakota and Lakota traditions, the concept of the red road refers to a spiritual way of life. It's a path of discipline and humility, prayer, honesty, respect. And so the term the red road is often used in contrast to the black road, which symbolizes imbalance and self-destruction and disconnection from spirit. But these aren't good versus evil kind of moral binaries. Rather, they're teachings about balance and consequence, and how our choices and our ceremonies and our relationships are healing all those connections. So the Red Road is not a Western recovery program translated into Native terms. It is wholly Indigenous, built from the ground up with Indigenous healing philosophy and ceremony and kinship and oral tradition and laws of nature. So sobriety is about walking in relationships. But sobriety is not the ultimate goal. Sobriety essentially is a byproduct. It's a happy byproduct of returning to balance. It's kind of like when you do something and then you enjoy happiness because of it. The happiness is the byproduct, not the purpose for doing something. That's kind of what the Red Road of Recovery is. It's about it. So it's not something that separates the mental and the physical and the emotional and the spiritual. All of these things come together in ceremonial re-engagement. So sweats and pipe ceremonies and fasting and language reclamation. And this is healing of the spirit and connecting to the sacred sounds and stories of one's ancestors. It's acts of service and kinship repair, where people make amends not just to others, but to the land, to the water, to the spiritual world. And to community accountability, where elders and family and cultural mentors walk alongside a person, not as case managers, but as spiritual relatives. So this is important for you as future counselors to understand. the red road is not treatment you deliver. It is a life path the client may choose to reclaim. So we don't lead someone down the red road, but someone might choose to follow the red road towards balance and recovery. And it's our role to support, respect, and make space for that choice. Along those lines is Native-led programs like the Wellbriety program, which was something that was founded by White Bison. And in that, the red road is central. So Wellbriety blends 12-step models with Native teachings and emphasizes the 4 laws of change, the medicine wheel, and the use of culturally specific rites of passage. And this approach has been especially effective in engaging Native men and women coming out of incarceration or long-term addiction, because it teaches recovery in a way that is restoring identity first. And recovery is a happy byproduct of that. So, to walk the red road is not to follow a treatment plan. It's about alignment with sacred law. And so as a counselor, especially if you're not Indigenous, your role is never to lead someone onto that path, but to support their ability to find it again if they choose. So, I just want to be clear. The red road is not a metaphor. It is a lived spiritual reality. It is something that is particular to Plains people like the Dakota and Lakota and Nakota. And at the center of the red road is the understanding that each person has a sacred purpose, and that addiction is not a moral failure, but a sign that there is spiritual disorientation. And many who walk the red road describe their addiction not as a disease in the Western sense, but a misalignment of spirit, of forgetting who they are and what they're here to do. So the red road really kind of emphasizes some basic character principles. First off, honesty. Be honest with yourself. Don't be lying to yourself. Be honest with your family and with the Creator. Have courage. Courage to face shame, to ask for help, and to come back after falling. To show respect for yourself, for life, for land, for others, and for the sacred. And to have humility, to listen, to learn, to walk in the good ways. And these teachings are lived through daily practices of smudging and prayer and fasting and offering tobacco and visiting sacred rites, participating in sweats and other ceremonies. Now, if you're not Indigenous, or even if you are, but these aren't your teachings to carry, your job is not to not to imitate or take ownership of this model, but simply to create a space for it, for other people that may want to choose this. It's about protecting this as an opportunity and respecting its boundaries. It's about asking a client if they would like ceremony, offering flexible scheduling so that a client can attend a sweat, collaborating with elders or cultural liaisons, or helping the client to connect with Indigenous knowledge holders, and being willing to fight any institutional barriers that might get in the way of the person following the red road. And the thing to kind of remember is the red road is, first off, again, it's not about sobriety. It's about balance. It's not about being perfect. It's about trying to live as you were meant to live. with meaning and respect and humility. And sobriety, then, is a happy byproduct of that, because none of us were meant to be living in addiction. Now, let's look a little bit at some of the ethical framework that guides our role as counselors, not just because of professional codes of conduct, but because the laws and lived realities of Native sovereignty are important as well. So, to be ethically responsible in Native spaces is not only about using inclusive language and celebrating ceremony, it's about recognizing that you are entering a nation-to-nation relationship, one that, with its own laws and governance and knowledge systems and sacred responsibilities. Remember, tribal nations are sovereign. And this means that they have the right to self-governance, to define their own health systems, and to determine what healing means within their own cultural, legal, and spiritual frameworks. So as counselors, whether you work within a tribal system or serve Native clients in non-tribal settings, you need to always act in a way that honors that sovereignty. And, just taking the perspective of professional associations like the ACA, American Counseling Association, and NADAC, the National Association of Alcoholism and Drug Abuse Counselors, their codes require this, that we need to practice within the boundaries of our training, and that we defer to Indigenous governance laws and healing traditions, not just because it's ethical, but because it's a matter of jurisdiction and consent and community self-determination. So part of this is recognizing your limits. So, for example, if you're not Dakota, it's not your place to explain the meaning of the sweat lodge to a client or to guide someone through the medicine wheel teachings. We might have read books. We might think we're being helpful. The important thing is to allow that person to have a place for this, or encourage them to discover for themselves those meanings, those teachings. But we're never the expert in them. Something we can do, though, is advocate within our organization to ensure that policies and treatment models allow room for Indigenous healing, not just as add-ons, but as core competencies of recovery. Now, when we talk about healing in Indigenous communities, we need to understand that healing is rarely seen as an individual journey. For many Native peoples, wellness is a collective process rooted in community, in kinship, in land, in spiritual tradition. So, when a Native client begins to recover and reconnect and restory their experience, not just in clinical terms, but through ceremony and kinship and land, they don't just get better, they often begin to repair what colonization tried to break. The relationship to self, to family, to spiritual teachings, and to community. So many Native-led programs already do this. I've already mentioned the Wellbriety movement. It's not just about sobriety. It's about encouraging people to heal intergenerational trauma, about encouraging them to engage in truth-telling within the family, to return to tribal roles as protectors, as aunties, as helpers, as teachers, as song carriers. That's not a treatment goal, but it is cultural resurgence, and it is healing. And we need to recognize that that is part of the healing process. So counseling in this model becomes a space where a person is given back to their people, where what was lost through trauma and addiction and incarceration returns. So even in individual sessions, you may witness this. A client remembers their native name. A client decides to start learning their language again. A client begins attending powwows, not out of obligation, but out of joy. These aren't just small wins. These are acts of reclamation. These are acts of healing. This is about helping people heal in their life. It's about helping people heal in their community. This is about helping to strengthen not only the individual, but the people around them. So as we come to the end of our session on working with Native American populations, let's just revisit the three foundational concepts I kind of want to get across for this one. First off, the whole idea of historical trauma is something that is ongoing. Native clients, they may carry inherited grief. This is something that literally can change your DNA and DNA expression and genetic expression. It's an epigenetic phenomenon. It's grief from colonization, grief from boarding schools, grief from inherited addictions, grief from intergenerational family trauma, it's grief from systemic loss. And that pain is not just historical. It is lived in people's bodies, in their families, in their behaviors, in their stories, in their social practices. And your role is not to diagnose history out of someone, but to honor how it is lived within them and how they have found resilience in that. The second principle of the idea that healing is not just individual, it is cultural, it is spiritual, it is collective. Now, recovery for many Native clients is rooted in ceremony and language and land and kinship, not just cognitive or behavioral change. True, healing may look like a return to the sweat lodge, a song remembered, or a prayer offered in one's ancestral language. It may look in many different ways, and we need to be mindful and leave space for that. And finally, recognizing our role is to support, not to lead. It's about basically being client-led, but in an Indigenous sense. Particularly if you're not Indigenous, or if you are, but this is not your place. Your role in being a counselor for someone struggling with addiction and they're Native American is this: respect the path. We don't need to walk it for someone. We don't need to tell someone where to go. But we need to respect the path. We're not the keeper of medicine. We are the ones who make space for its return. And that can be enough, I think. Now, here is a little scenario for you to kind of think about a little bit. So you're working with Ryan, and Ryan is a 28-year-old client from the Lakota community. He's early in recovery from alcohol use and shares that he wants to reconnect with his spirituality, but feels unsure where to start. He says, I think I need to go to ceremony again. I missed that part of my life. And he asks if it's okay to talk about it within session. And what is our role? Well, I would suggest that the answer there would be C. That our role there is to affirm his desire to reconnect and ask if he would like to share more and offer support in helping him access cultural resources. Because what this does is it demonstrates, first off, cultural humility, It honors the client's spiritual and cultural identity and supports their healing journey without appropriation. It keeps the counseling relationship open, respectful, and client-led, which is where we want it to be. Now, as we close out our session, I just want you to kind of be mindful of this. And just kind of remember this little phrase, we're still here. That is something that is very powerful. Just think of that statement from a Native American point of view. Despite all of the injustices, despite all of the trauma, this is a statement of survival. It's a declaration of sovereignty, of cultural continuity, and of sacred presence. Working with Native American clients is not just about being culturally aware. It is about being relationally accountable to the land, to the community, to the stories that have not been told in textbooks, and to the spiritual healings and teachings that continue to guide Indigenous people today. And it's about helping clients to find their own path along that red road of connection with community, with ancestors, with story, with song. So what have we learned today? We've learned that historical trauma is clinical. It affects how people show up in treatment. We've learned that healing is cultural, that ceremony and language are not just side notes. They can be central to the healing process. And we've been reminded of respecting sovereignty, because that is the ethical way of caring. We are not the center. Our worldview is not the center. We are there instead to help engage the client in their worldview, in their relationships, in their spiritual paths. And we are there to help them with that, to find healing, to find strength, to find resurgence, to find respect, and help them to find respect within that and what is sacred. Hope you enjoyed this lecture, and I hope that you can remember to be humble and curious and live with care. You take care. I'll see you next week. Bye-bye.